Hi everyone, I hope you're doing great. I hope you're keeping safe. I hope you're sanitizing and wearing your masks. Welcome to yet another episode of Akuya Togere, a queer feminist podcast based in Uganda. To our audience that is outside Uganda, Uganda is undergoing a 42-day lockdown, meaning we are locked at home. All public and private transportation has been suspended, so we cannot move. However, as an organization, we have shifted our work from working physically to working virtually. So our drop-in center is still happening. It's still serving you. Please do not hesitate to reach out should you require information, should you require services, but also should you require help. I think we are a few days into the lockdown and we've been receiving our toll-free line is jammed with calls of people that are reaching out because they need mental health support. I know this is a hard time, especially for people that are locked down, because some of you are locked down with your families that are very abusive. Some of you are locked down with your partners that are very abusive. Some of you are locked down alone. You're in the home alone, so you feel so isolated and you need someone to talk to. We are here to serve you. We are going to continue to serve you. We'll provide all the mental health support you need and also the legal support that you need. Please do not hesitate to reach out. Call, WhatsApp, text. We'll hook you up with a counselor. Our counselors have also shifted their work virtually. So now they are texting you back. They are WhatsApping you back. They are calling you. But should the situation be very intense, we will video call you and talk to you from home. Our DIC, because it's operating virtually now, we are doing home-based care. What does that mean? That we are able to bring the medication that you need to your home. But also if it's an emergency and we are unable to get you an ambulance, we will move the health worker from the health center to your home so they can treat you from where you are. Our GAP members, GAP is short for God Answers Prayers, and that is our program for LBQ women that are living with HIV, which provides nutritional and adherence support. Please feel free to reach out if you're a member of GAP. I am begging you, do not go onto a drug holiday. Please reach out. We will give you the food that you need to be able to adhere. But also if you just need support, someone to talk to, someone to encourage you to keep going, do not hesitate to reach out. Because it's a free time, some of you are working from home, but some organizations have, or companies have totally suspended work. So what are you doing in your free time? I have a recommendation for you. Read our new book, our new publication, which was launched last month, Queering SRHR, a guide for LBQ women. It's part of a bigger project that was Queering SRHR that was supported by Amplify Change. And in this publication, you'll find quite a lot of information about LBQ women, what our SRHR needs, what are our challenges, what makes it hard for us to access SRHR services in health centers. Even as a health service provider, this book is for you. What can you do? What commitment can you make to make sure that LBQ women in your health center, in your hospital, are able to come freely and be served better? This project is coming to an end and it's very heartbreaking. I hope Amplify Change is able to renew it, because part of what the project did, one, is broadly it was a project about queering SRHR. So it was a project that gave voice to LBQ women to speak for themselves about what their particular SRHR needs are, what is not being addressed for them in regards to SRHR, what is making it hard for them to access SRHR services, but at the same time what can be done better to ensure that even when we access, we are able to retain. If I go to a health center today, I'm able to go back and recommend other LBQ women to go to that same health center. So we created content for the community that we represent, which is LBQ women, but also by the community that we represent. So we started with learning conversations. We came up with, our inception itself was just a meeting with LBQ women to brainstorm. We worked together on what do we want this book to present, what do we want this book to say, what do we want the world to know about SRHR for LBQ women. And over a period of 11 months, we worked with LBQ women to create content for this book, right? And then when we created content for this book, of course, when a book is created, there's all the process you go through of proofreading, editing, and then it's published. What happened after it was published? The LBQ women that were part of the process of creation then went and had dialogues with health service providers and educated them and informed them about what their SRHR needs are, what their challenges are. Small things like you talk to a health service provider about, why is it hard for me to come to your health center? How do I feel about the way you treat me when I come to your health center? What can you do better to make sure that when I come here, I'm able to come back tomorrow, but also I can encourage other LBQ women to come. And by the time we were done stand with the entire project. It was such a massive success. We had educated close to 108 health service providers about LBQ women, SRHR and health. We had received commitment from close to 9 health centers across 6 districts. We went to the north, we went to the east, and we also did work in the central. We had empowered LBQ women, some of who are now sitting on committees. We now have an LBQ women sitting on a committee of right here, right now, which is a health consortium. It's a consortium of different organizations that are working with youth, advocating for better health services, inclusive health services for all youth, regardless of anything, age, sex, sexual orientation, gender, whatever. We have SRHR champions now that can stand and advocate, that can stand and educate, that can create content that informs. But one of our biggest successes of this project is I personally, the person speaking, Gloria. For those that do not know me, I'm the programs director of Freedom and Rome as well. And I had a call from one of our partner organization, TEU, which is Transgender Equality Uganda. TEU is a trans women's organization. So they had a project they were running then that involved mapping of stakeholders and holding conversation with stakeholders on how they can reduce discrimination towards trans women. I carried my book because there are trans women that are lesbians. We recognize them. Our project is about diversity and equity. So every queer woman, every non-conforming woman, every woman that does not conform in their entire diversity is represented. While I was there, I gave a brief about our book because we had health workers in our midst. And guess what came out of the meeting? Now, trans women want to create their own version of queering SRHR, a guide for trans women to make it easier for health service providers that are serving trans women to understand their SRHR issues and how they can serve them better. Each of the health service providers we went to was very inclusive, was very welcoming, because many of them have been open to serving LGBT people, but they do not understand LBQ health, LBQ issues. Because one of the things that our Ministry of Health pushes a lot is MSM and trans people. We are always fighting for a space. We are always fighting for inclusion as LBQ women. So for the health service centers, most of them that we went to, they were like, oh, we are happy that you've given us information on LBQ health. It's going to make it easier for us to serve LBQ women. Drop-in centers of organizations that we worked with. We appreciate all the organizations in different regions of the country that opened up their drop-in centers as reference centers for our publications to be available for health workers and for LBQ women. If I do not mention here, probably don't remember it offhand, but I just want to appreciate everyone that did what they could and that involved themselves in making sure that this project was a success. Our launch itself was a massive success. We had close to 80 people from across civil society. We had police. We had like an ASP, Assistant Inspector General Police, I think. We had health workers from across so many health centers that came to support us, LGBT organizations that have our book showcasing all part of your library, in your resource centers, social media, so many other networks, so many organizations and partners have shared the link to the book. And it takes me back to what I was talking about earlier on. You're in lockdown. Some of you are not even working from home. What are you using your time to do? Utilize it to listen to a podcast, read our book. You can find it across so many platforms. You can find it on our Facebook, Freedom and Rome Uganda. You can find it on our website, www.faruganda.org. You can find it on our podcast on YouTube and on Google. Bakuya will get it. You can also reach out to our drop-in center. We'll send it to you via WhatsApp. We can also send you a printed out copy if you want one. We appreciate the support of Amplified Change for believing in us and creating, because this is a landmark, honestly, that we've created. This is the first publication in Uganda that is exclusively showing anything to do with SRHR, that is exclusively sharing stories, challenges, but also giving recommendations on how health centers, on how government can serve and work with LBQ women. But I do not want to think our project is stopping. We're like, okay, this is the end of, I want to say phase 1, and I believe that you'll continue supporting us. One of the things that our project did is it increased demand for access to SRHR services for LBQ women. Our DIC is jammed. To be honest, now we're not able to serve the number of clients that we receive on a daily in our DIC. They reach out asking for information, they reach out asking for consumables, they want sanitary pads, they want self-testing kits, they want medication, especially for STIs and UTIs. They reach out looking for e-referrals and linkages, which is also a success, because now we have like a directory of organizations and of health centers that are willing to work with LBQ women. So any LBQ woman across the country can reach out and they're like, hi, I want access to free healthcare that is non-discriminatory. Where will I go to? And then we'll call our contact person and be like, if you're in Gulu, call Dr. Opio, go to Gulu Referral Hospital, I will serve serve you. If you're in Barak, all this and this. So the project did much more than we had anticipated, right? Information was disseminated. LBQ women were empowered. We have created an entire directory of health centers that are willing and ready to serve LBQ women better. But at the same time, it has evoked a new thinking about how we can re-establish and re-expand our drop-in center. Now, we are seeking for money to have it functioning as a mini clinic because there are things we're not able to do. Previously, our drop-in center did a lot of work to do with mental health support and information and a few consumables, but a lot of our medication was first aid. Now we want it to be fully fledged. We want health service providers seated there full time. We want a laboratory. We want to be able to serve LBQ women when they come in there. Like if I want to test for malaria and get malaria treatment, there's someone to serve you and provide that treatment to you for free. If I want to test for an STI, if I want to test for HIV. But also, one of the biggest things we want to do for our drop-in center now, based on the demand that came out of the impact of the project, is now we wanted to have it as a place for art and prep, not only refills, but like we have to have it as an art and prep center. So an LBQ woman who has gotten to know their status that they're living with HIV can come to the center, adhere to their medication and be supported instead of sending them to the other facilities that we send them to. We appreciate all the support of Amplify Change. We appreciate the trust because you trusted us when you told you wanted to do this book, when you didn't know if we were capable of or what kind of material you are going to do with the book. And the impact that the book has had, if you have a social media person, I highly recommend that you type in Queering SRHR, a guide for LBQ women in Uganda. You'll see all the information, all the tweets, all the Facebooks, all the recommendations that different stakeholders have had of the book. And to LBQ women in Uganda and beyond, I highly recommend that you read this book. It's rich on information. It's going to help you understand and learn quite a lot of things. To the LBQ women in Uganda, please continue keeping safe. Wear your masks, sanitize, social distance. Farouk is still open virtually to serve you. Please feel free to call our toll-free line, which is 0800 1093. You can also reach out to us via Facebook, Freedom and Roam Uganda. You can DM us on Twitter, _Uganda. You can DM us on Instagram, _Uganda. You can send us emails on our official email, which is faroukinfo@gmail.com. To the rest of the world, we are struggling as an economy, we are struggling as an organization, and we are struggling as LBQ women in Uganda. We appreciate any kind of support that comes out. Please feel free to donate to us by using our website, which is www.fauganda.com. You'll find a donate button there, which will direct you on the prompts you should follow if you want to donate to us. We appreciate donations in time, so you can volunteer with us. We appreciate donations in things. You can donate like a laptop, you can donate clothes, you can donate anything that is physical. We also appreciate donations in money because then to help us continue serving our community better and reaching out to LBQ women. Thank you so much for listening to this episode of Bakuya Tuogere. Please tune in next week to listen and to learn more about us. Bakuya Tuogere, she said what she said.